Hi, Suan. How are you?
Very well, thank you.
Wow, what a beautiful home. Tell me, in 3 words, how would you describe this home?
Layered, alive, and uniquely ours.
What was the guiding vision?
I really wanted every corner to evoke positive emotions and spark meaningful conversations.
There's art absolutely everywhere.
Yes.
What's your rule for what comes home with you?
3 rules. The story behind the work has to resonate, the artist's story behind the work, and thirdly, whether we see ourselves still loving it 20 years from now. All 3 boxes get checked. We hope it comes home with us.
Thank you for sharing your morning with us. Do you start every day with coffee or matcha?
Ooh, always coffee. I don't want to talk to me before my morning coffee.
Talk me through the ritual.
So I tend to have French press coffee because it achieves the most consistency when I'm in a rush.
Would you ever prescribe yourself matcha?
There's actually a lot of data around L-theanine in matcha. So yes, I do try to have an occasional afternoon matcha when I can.
What is the first health decision you make every day?
Sunlight before screens whenever possible.
You studied in Cambridge. What drew you to Cambridge?
Well, I got a scholarship, but I really embraced the fact that it was a place where curiosity and questions were very much encouraged.
Were you always going to be a doctor?
No, I actually wanted to be a lawyer, but life takes you to different places sometimes. But I'm glad that it's still in a space that I can make an impact in people's lives.
What did Cambridge teach you that medicine didn't?
That sometimes asking the right questions is far more important than having all the answers.
You've worked in both the UK and the US. What surprised you the most about the US healthcare system?
There's a lot of innovation, science, and brilliance in the US, but often behind a paywall, and not everyone can access it.
Is there still one patient you think about?
Lots, but the ones that change my mind, I tend to remember most.
What brought you back to Singapore?
Singapore is where family and friends that I grew up with live, and it felt that the impact that we could make would matter most.
Is there anything that keeps a leader in healthcare up at night?
Not translating the knowing into action.
The most underestimated public health issue right now.
Metabolic dysfunction underlies a lot of early development of disease. Not enough people realize that.
Is there one thing you would change about how Singapore approaches chronic disease?
Treat the root causes, not the crisis, and act on them decades before disease develops.
When you founded NOVI, what was the founding insight?
That we really had lots of opportunities to do better, to focus on precision prevention rather than just managing disease.
You often talk about treating obesity as a disease rather than a lifestyle choice. Tell us about that.
Obesity often is viewed as a matter of willpower or lack of discipline. All not true. And there's so much more we can do to help people overcome this complex condition.
What's the biggest misconception about weight management?
It's not about weight loss, it's about gaining health.
You're a clinician, scientist, and a CEO. How do you manage all of that?
The science keeps me honest, the patients keep me grounded, and being CEO keeps everything moving.
Do you have a single non-negotiable health habit?
Sleep is my weakest habit and one that I keep trying to work more on.
Is there something you've completely changed your mind about?
I used to think discipline was the answer and I was so wrong. We often think of high performers as those who have the most willpower, but actually it's about habits that last.
What does longevity mean to you?
Adding life to years, not necessarily just years to life.
Is there one thing a patient could do right now to change their health journey?
Know your numbers, those that matter. Speak to your healthcare provider or doctor and really understand what they mean.
Your daughter recently represented Singapore at the SEA Games. What was that moment like for you?
It was a defining moment where I saw her step into something way beyond herself for her team, for the country, and that filled me with great pride.
The wall behind you is amazing. Your husband photographs all of the family photos here. What does that say about him?
He's the one that has the eye on the details when we're in the middle of the action.
You collect a lot of art, Singaporean artists specifically. Is that a deliberate choice?
Yes, I think Singaporean artists are super talented and they have a great visual story to be told, and I hope to contribute to being part of that record.
Is there any parallel between collecting art and medicine?
Both are a blend of science and art and require a lot of attention to detail.
Wow, this is a really lovely space. Did you ever think about being an interior designer?
I think just look around you and I'll let you draw your own conclusions.
Okay, we're nearly there. Last few questions. Rapid fire, coffee or matcha? Your final answer.
Coffee in the mornings, matcha in the afternoons.
Morning run or evening walk?
Evening walk, much more strategic to blunt those glucose spikes after dinner.
Is there one book you think everyone should read?
How will you measure your life?
Singapore or London?
Singapore feels like home. London was a beautiful love affair.
Okay, final question. Thank you so much. What do you hope people say about you, not as a doctor or a CEO, but as a person?
That she always showed up, even when things were hard or unclear, and that she fought hard for things that she believed in to make it feel a little bit less impossible for the next person.
Wow, thank you for sharing your day with us.
Thank you for joining me. We make health happen.